Mental health is in the spotlight. It's leading the future of telemedicine. Gala Batsishcha MD discusses the reasons and impact of this trend. Tune in. Why has mental health led US telemedicine adoption?
There are several reasons for that. The biggest trigger was COVID-19, and the next is the format. Mental health care doesn't require physical exams, and it is very well suited to video or audio calls. And then there is a big shortage of mental health professionals, especially in rural and underserved areas, and telemedicine helps to fill that gap. Also, people feel more comfortable because virtual care is private and easy. And on top of that, federal and state legislation play a really crucial role, expanding telemedicine access and reimbursement, especially for mental health.
Why is mental health such a good fit for telemedicine platforms?
Most medical specialties require hands-on exams, lab tests, imaging, or procedures to diagnose and treat patients. But as I mentioned earlier, mental health doesn't require physical exams, and it relies mostly on conversation, observation, and relationship between the patient and the provider. That's why those clinicians can effectively assess, diagnose, and treat many common mental health diseases remotely via one-to-one session, group session, or family counseling.
What technical infrastructure and clinical workflows are critical for telemental health delivery?
From technical perspective, it requires a secure HIPAA-compliant platforms, integration with electronic health records, reliable internet, and quick tech support to avoid disruption in the care. On clinical side, it's important to have a smooth scheduling, clear triage protocols to define patients suitable for the virtual care, pre-session setups, standardized documentation consistent with the in-person care, and also crisis management plans. And you can imagine, when both elements are aligned, then telemedicine becomes as effective as clinical care.
How do providers measure telemental health versus in-person care?
That's a really good question. For that purpose, providers need to track and measure patient outcomes, satisfaction, and engagement, and they use commonly accepted questionnaires, for example, Patient Health Questionnaire or PHQ, Generalized Anxiety Disorder Scale, and Well-being Index, and many more to monitor the progress, as they review the data and compare the effectiveness of the telehealth with the traditional care.
How can telehealth preserve tone and body language cues?
Of course, all of this matter, so providing high-quality video and sound is super important. For example, a therapist might notice a quick hesitation or nervous behavior on camera and check it with gentle follow-up questions. In that regard, training can help providers to recognize those signs online and handle them effectively. In addition to that, platforms can also offer features like adjustable camera angles and ability to pause without pressure, so that they create more comfortable and safe space for the patients.
How prepared are telemental health providers and telemedicine platforms for patient crises online?
This aspect is essential for patient safety. Providers are trained to follow a crisis plan if patient is at risk during the session. They know the patient location, they can use local emergency contacts and assess the risk in real time. In addition to that, many platforms provide additional features like emergency alerts, live support, quick access to 911 or crisis teams when needed.
What risks should providers of mental health services watch for as telemedicine adoption grows?
I think there are two main issues here. The first one is when the patient uses different platforms or multiple providers who are not connected. It can lead to duplicate therapy or even conflicts in therapy, especially if systems do not share the records. And the second one is access. Not everyone has a reliable internet or the right device or the private space for the therapy. So, you can see, while telehealth has a huge potential, it also needs to be well coordinated and accessible for everyone.
What ensures sustainable, equitable telemental health growth?
Perfect question to close with. The first, we need better system integration to prevent duplication therapy, more support for digital access, and strong lasting reimbursement policies. The second, we need to maintain security and patients' privacy. And the third, we should keep training providers, to deliver high-quality care, remote care.
Science Soft. Project success no matter what.